learn about health and safety monitoring and measuring. How we gonna measure health and safety in our organization and how we gonna measure them. So what are the tools that we can use for the monitoring and the measuring? See, health and safety monitoring and measuring are a very important part to make sure that your health and safety plan is working efficiently and is it working as per your requirement. So that's why we have to monitor it and we have to measure it. So monitoring systems, what are the monitoring systems is available? How the monitoring will be done? How you can do the monitoring? Measurement is essential to maintain and improve health and safety performance. Two ways of measuring performance are active monitoring and reactive monitoring. So let's say that what are the things are included in the active monitoring. Active monitoring means which monitors the achievement of plans and degree of compliance with standards before an accident, incidents, or ill health. So active monitoring, what are the things are included in the active monitoring? All those things which you will use to monitor the performance of the company before any accident, ill health, any injury will happen. Those are the tools which you are using. That all tools will come under the active monitoring. Okay. After that, reactive monitoring. Reactive monitoring, which monitors accidents, ill health, incidents, monitoring after the event and learning from mistakes. Reactive monitoring, react. You will react. When something will happen, then react will have to react. So that thing is come under the reactive monitoring. Okay. Now, active monitoring. What other things are included in the active monitoring? Active monitoring, workplace inspections. You will do the inspection. Inspection it could be like daily inspection, weekly inspections, or monthly inspections. Then safety tools, which you will take. Safety sampling. You are taking some sample from some of the area, from some of the places. Safety survey that you are conducting. Health surveillance over the workers that you are conducting. Review of training assessments, records and needs. You are reviewing the training assessments. You are interviewing the employees. You are asking the question to them and you are analyzing their training needs. After that, management system audits. You are doing the audits. Consideration of regular reports by regular reports by bodies, like any audit happen from the government body side and you are evaluating their their reports and you are evaluating your performance, how you perform during the audit. After that, behavioral observation. You are observing the people while you are taking the safety tours. You are doing the workplace inspection. You are observing your people, how they are behaving, how they are acting towards hazards. So all these things comes under the behavioral observation. Now, definitions. Proactive or active monitoring. It is the safety inspection. Safety inspection is a routine scheduled inspection to make an immediate check on standards that you will do on timely basis. Safety sampling. Organized system of regular random sampling by systematic recording of hazard situations observed during inspection made alone predetermined routes. Example, noise test, dust test, like light level, PPE, lifting. So other things that you will check. Safety tours, it is a planned visit to the workplace to observe and discuss the controls in use, mainly done by the management. These are the tours are done by the management. After that, safety survey. Safety survey is a detailed examination of particular safety issues, example, noise, lighting, dust, temperature, PPE, etc. Then we have the safety audits. Safety audits, every area of an organization is subject to a thorough and systematic examination. Now, reactive monitoring. What other things are included in the reactive monitoring? Reactive monitoring, as we know that when something will happen already, then we are acting on that one. That we are calling reactive monitoring. Okay. So, accident incident rates, ill health incident rates, accident frequency rate, sickness absence, property or product damage, incident, and near misses. These things will come under reactive monitoring. Now let's start our 4.2 lesson, investing, recording, and reporting incidents. How we gonna investigate, how we gonna record, and how we gonna report the incidents that we're gonna learn. Accident investigation. Why we need to investigate the accidents? As all we know that we should investigate the accidents. Why? Because it could be a legal requirement. It could be required by your SOP, your manual, your documentation requirements. It is required by the law that each and every accident and incident should be investigated and control measures should be implemented. We need to investigate the incidents and accident because it is a moral obligation also. It could be the financial reason. Why? Because during the incident and accidents, you lose some business, you lose the money, you have to pay the higher insurance premium. So that's why you need to investigate the accidents. Social, legal, economic, prevention of reoccurrence, so that we have to make sure that that incident will not occur again and again. Identification of trends and data gathering. That's why we are doing the investigate the incidents. Now, why do accidents happen? There are many reasons behind the accidents, but if we will go from top, we can say that it is the purely lack of management control. Your management control of management is not working properly. And after that, there are some underlying causes, some immediate causes that will lead to accident or near miss. If there is an accident, definitely there will be some loss or injury. Now, accident cause and domino theory. As we know that domino theory, root causes, underlying causes, unsafe act conditions, accident, loss, injury. So one of these is a root cause. When one is fall down, so everything will fall down. So that is a domino theory. Root causes are equivalent to lack of management control. Now, accident investigation. Make area safe, select level of investigation, gather and record the facts, analyze the facts, draw conclusions, make recommendations, review the process. These are the steps you have to follow whenever you are doing any accident investigation. The first step what we have to do, we have to make sure that area is safe. So no other person they will get injured. One person is already injured or some people they already injured. You have to make sure that area is barricaded. No one will enter that particular area and other people they will not get injured. You have to select the level of investigation. What level of investigation you want to do. After that, you have to gather and record the facts. You have to do the interview with the staff. You have to take the picture of the accident areas. You have to check if any equipment is involved. You can take the maintenance records and certain other records you have to take. After that, you have to analyze these records and the findings that you gather during the investigation. After that, you have to draw the conclusion. Draw the conclusion means you have to get the root cause. Until unless if you are not getting the root cause, it means that your accident investigation is not completed. So you must get the root cause. So once you get the root cause, you have to make the recommendations to make sure that that same incident or accident will not happen again in the future because of the same thing. And you have to review the process. Why we need to review the process? Why? Because the process is not proper. That's why this accident or incident happened. So that's why you have to review the process and you have to make sure that the process is working properly and that process will be affected also. That accident investigation, select level of investigation. As I said, who should investigate, who should be in the team, health and safety practitioners, staff representatives, supervisor or manager. Accident investigation, these are the things will involve while you will gathering the information, the scene, documents, people. After that, open questions to ask. Whenever you are gathering any information, you will do the interview with the staff. Whenever you are doing the interview with the staff, always ask open-ended questions. Make sure you are not asking them Yes or no questions. Did you see the area? They will say yes. You have to say that how area was. So they will explain it. How, who, where, when, why. Why did it happen? When did it happen? Who was involved? So open-ended question you have to ask, not close-ended question. Now, analyzing the facts, unsafe acts and conditions. These are the direct causes of accidents. They can be broken down into materials and substances, equipment, environment, and people. You have to remember MEEP. Okay, MEEP. Materials, equipment, environment, and people. These are the four things they are directly involved in the accidents and incident. Most of the time, they will be involved. Now, recording the information, report formats may be used computer-based systems, different fields used in program, type of accidents, part of body injured, job type, and location. Analyzing the facts. It is important to understand the terminology, recording and analyzing the results, cause of accidents, as I said, root cause, type of accidents, and cause of injury. Now, reviewing the process, what were the direct causes? What were the underlying causes? Why did management system fail? Why was the system failure not identified before the accidents? How effective were the emergency procedures? So all these things you have to analyze, you have to review your process because all these things may be included in the process. Now, the accident reporting. What are the barriers to good accident and near miss reporting? As we know that so many times people employee they don't report the accident and near misses because there are some reason behind it. People they are maybe afraid with the management. Maybe the management is not friendly with the people, the employee. They think that if they will report it, they will get penalized. How can these barriers be overcome? How we can remove these barriers? The accident book or accident forms normally contains a minimum of recorded information. Note, company devised accident records can be used to replace the standard accident recording book if they are sufficiently comprehensive. You can use the accident book. Now, reporting. What are the reportable events? They are what are the accidents we have to report, near misses we have to report, occupational accidents, occupational disease, and dangerous occurrence. All these things your employee should report. Where do we find principles and standards of reporting? Published standards appear in Protocol to the Occupational Health and Safety Convention P155 and the Convention 155, C155. It is supported by the Recommendation 194, which lists diseases that should be reported by national governments. These are the requirements regarding reporting. The reporting of an event is to that the relevant enforcing authority by a responsible person nominated by the employer. Procedure will vary according to the national legal practice. What are the reportable events? Major injury or death that should be reported, dangerous occurrence, any disease, a worker absent from work for 3 consecutive days due to an accident at work that need to report it. Immediate hospitalization of non-worker if anyone is getting hospitalized. Now, some examples of reportable injury events. Major injury, fractures other than the finger or toes, any amputation, dislocation of shoulder, hip, or knee, loss of sight. Dangerous occurrence. Dangerous occurrence, contact with overhead cable, train collision, collapse of scaffold, failure of lifting equipment. Now, what are the disease and ill health? They include work-related upper limb disorder, dermatitis, decompression, sickness, leptospirosis, asbestosis, occupational asthma. So these are the disease, ill health things should be reported also. Now, health and safety auditing, how we can audit and what is the importance of audit in health and safety. Now, auditing, it is an audit. An audit is a systematic critical examination of an organization system to determine the compliance against set of agreed standards. So during the exam, maybe they will ask you the definition of audit. What is an audit? So you have to give this definition. An audit is a systematic critical examination of an organization systems to determine the compliance against the set of agreed standards. Now, the key features of an audit. What are the key features of an audit? It should be independent. It should be systematic. It should be planned, comprehensive. It should be objective. And it should be evidence-based. Audit provides confirmation that the health and safety systems are in place and are effective. They should be effective. Provides evidence of legal compliance, reports on non-fulfillment of obligations, encourages continuous improvement in the safety management system. These are the objectives of the audit. Now, how we can do the audit? First of all, it should be planned. You have to plan that how you going to do the audit, where you going to do the audit. Once you plan, make the plan, it should be informed to the auditee. Notification of the audit. You have to send the notification to the auditee, okay, whom you're going to audit. Now, once you send the audit notification, you have the selection of staff or team. Then competence of auditors, responsibilities, then time and resources that you need, opening meetings, site visit and document records review, recommendations, NCR corrective action plan, and follow-up. Now the audit areas, what you will audit. You will have to audit safety policies, organization, safety committee and representatives, first aid and medical requirements, fire and bomb arrangements, crisis management, emergency process, insurance, staff development and training, risk management, vehicle and passenger safety, work experience, shadowing, hazardous pursuits, outing, safety inspection. So whenever you are doing any audit, I will suggest you use ISO 45000 2018 standard to do the audit. So most of the things you will cover from that. So it will be very easy for you. Or if there is any process within your company that you want to follow, that's up to you. Now, control of substances hazardous to health, building maintenance, purchasing, control and execution, welfare facility, personal protective equipment, pregnant women, radiation, environmental protection and waste management, all these things you can check during the audit. Now, reviewing health and safety performance, how you gonna review them? Purpose of regular reviews. Reasons why an organization should review its health and safety performance to identify whether the organization is on target. If not on target, why not? Continually improve. If we have to continually improve, we have to review. What do we have to change so that we continually improve? For example, are there risks that aren't being controlled adequately? What needs to be done about them? Because monitoring is an essential part of any management system. Regular reviews, it is required by the ISO management system also, ISO 45001. It is required that management should do regular reviews. Issues to be considered in reviews. Whenever you are reviewing anything, you have to do the meeting, okay? You can do the yearly review, you can do the biannual reviews, okay? But whenever you are doing the review, you have to mention at least these things. Legal compliance, whether you are complying with the legal requirement or not, that you have to mention. Accident and incident data that need to be reviewed also. Safety tools, sampling and inspection, reactive and active monitoring that you have done so far in the past that you have to involve. Absence and sickness data, audit reports, achievement of objectives, environment enforcement action, previous management reviews that need to be discussed also, legal and best practice developments, these need to be discussed. These are the things you have to involve in the management review meeting. So if you need more brief information regarding what you should include in the management review meeting, you can go to the ISO 45001 2018 standards. In that standards, you have to go to the clause number 9. In that clause number 9, it has informed you regarding the review process. How you're going to review, what should be, what you should include in the review process. Clear? So that's all from the